I'm Commander Eric Parlette, and I'm one of the Medical Operations Center doctors on the USNS Comfort. I'm a naval reservist assigned to the Naval Leadership and Ethics Center in Newport, Rhode Island. I ended up on this mission when I was called and asked if I wanted to be a part of this deployment, and I said absolutely. It's an opportunity to be part of a monumental opportunity to give back and serve. Like most other reservists on the mission, where we've done this entirely voluntarily. On board, my responsibility is as one of the 4 physicians in the Medical Operations Center, and our job is to help establish relationships with the community hospitals and best align the assets that we can provide to help maintain and deliver care and help share that burden of the great number of patients that are being seen in New York City. So we're just trying to best establish relationships and help the surrounding hospitals. Getting ready in such a short amount of time is obviously, a lot of things coming at you all at one time can be overwhelming, but it was also kind of invigorating. You're taking on a new challenge and a new adventure. That's one of the great things about the military, why I loved active duty and I love the reserves, is that there's always new opportunities to serve and give back, and it's inspirational just being around so many people that are so selfless and generous to give of their time and their lives to serve. And there's a healthcare evacuation call center on the ground off the pier here that has been instrumental in coordinating those contacts with the hospitals. So hospitals have been given a list of the resources so they know what we can best take care of. And then they contact the health evacuation call center, who then coordinates with us so we can get the necessary information, the patient details and data, to make sure that we have all the assets on board to best deliver that same quality care that they're getting out in town, and just help share that responsibility. So the entire process involves a lot of different pieces. It's pretty complex. It's not just as easy as getting a phone call and bringing the patient on. So when we first got here, we had one process, and it's continually evolving as we learn more and as we learn how we can better expedite and facilitate the process. So we now have several doctors that are actually going out to the community hospitals that are able to see the patients face to face, have access to the records right there, to take some of the burden off the physicians that are working in the hospitals too. That way they can call us directly and say, hey, this is a great fit, we can provide the care that this patient needs on the Comfort, and they can call us directly. And most of those physicians have actually worked on the Comfort in the past, so it's actually speeding up the process. And if everything coordinates with what they have and we have the assets to take care of that patient the best as they need, then we call that healthcare evacuation call center back, and they arrange a transport for that patient, for the emergency medical services, to go pick that patient up and deliver them straight to the USNS Comfort. So once we have a patient identified that we're going to receive to take care of here, it's another whole cycle of communication and coordination. So once we have that patient identified, we'll reach out to the admitting physician of the day. We'll reach out to that doctor, give them a brief on that patient, make sure they're aware of that patient's healthcare status, what we're going to be doing for them. And then we also call the nurse of the day, who's the coordinating nurse for the day, figure out what ward's going to be best able to serve and take care of that patient, make sure we have beds available for that patient. And then we have the operations planning, make sure that they're tracking the patient, so we have proper accountability, make sure we're tracking all the patients when they arrive, make sure they're checked in, and when we discharge patients back to home. I think the progress so far has been really great. It's a continual learning process. Every day we learn something new, every day we have a new challenge, and with the great team of people we have, we continue to evolve and flex and maintain our malleability so that we can meet the changes that come every day. Some of the best lessons so far is just teamwork and humility. I think having such a large number of people coming together in such a short amount of time some that have been on the ship before, many that haven't, breaking down silos in communicating, learning the assets, and building up basically a hospital from scratch, a floating hospital, with new staff so rapidly, and then being able to move into a new city, establish those connections is just a great testament to the communication, the leadership, and just the resilience and motivation of the crew. It's been amazing. My other previous deployment was with the Marines, where the Marines were at the tip of the spear, medical was the asset to them, whereas now healthcare is basically the tip of the spear. So with the healthcare providers being the kind of the directors or the ones steering kind of the battle that we're having against the virus is very unique. Some of my feelings about being here, I think it's a terrible time for our country, for the world as a whole. There's a lot of people suffering in many realms from, obviously the health and wellness is the biggest crisis, but a lot of people are feeling pain in other ways, whether it's jobs or finances. But being in this environment is also just invigorating. You see the true testament to humanity and selflessness. You see the greatness in people as well here, and people coming together to give of themselves and just help millions of strangers. We've seen, for example, people that have some of the EMS services that we've worked with have come from halfway across the country just to serve and give them themselves. So just that inspiration, seeing people want to help fellow Americans and give back, that's probably the greatest takeaway that I've had so far.